Brought to you by Dr. Joe Ordia. Frequently asked questions about neurosurgery and pain management. Questions 61 to 65. History of pain management. I start with a disclaimer. The opinions expressed here are for general information and based on my own professional experience. They are not intended to replace the advice of your healthcare provider on your particular condition.
Question number 61. How was pain treated in ancient times?
Answer. Ancient cultures dating to around 3000 BC, including African, European, Oriental, and the Americas, believed that pain was a form of punishment or possession by demons for moral transgressions and wrongdoing. Treatment primarily involved rituals, offerings to appease angry gods, and the use of herbs. The poppy seed was used by the Sumerians of Mesopotamia mainly for its euphoric effect. Acupuncture was introduced in the Far East to balance the philosophical forces of yin, darkness and passivity, and yang, light and activity. A deficiency in yin was linked to chronic dull pain and insomnia, while an excess of yang was associated with acute, sharp pain, fever, inflammation, and anxiety. The beginnings of pain management are commonly traced to ancient Greece, around 2000 BC. The word pain originates from Poine, the name of the Greek goddess of revenge. This was rooted in the ancient belief that pain was divine punishment for moral transgressions and wrongdoing. In Greek mythology, the god of medicine and pain relief was Asclepius, the son of Apollo, the god of healing. The Romans referred to him as Aesculapius. He is often depicted holding a staff with a serpent wrapped around it, which has been used as the symbol of medicine since 800 BC. It should not be confused with the caduceus, which features two serpents intertwined around a staff with a pair of wings at the top. In 1902, it was adopted as the insignia of the United States Army Medical Corps. Temples dedicated to Asclepius were frequently visited by people who were seeking treatment for chronic pain or other ailments, and treatments were guided by priests.
Question number 62. How did those earlier beliefs about pain change to a more scientific explanation?
Answer. Hippocrates, 460 to 370 BC, is considered as the father of Western medicine and a descendant of Asclepius. He wrote the original Hippocratic Oath, which begins with, "I swear by Apollo, the healer, by Asclepius," and includes, "I will use those dietary regimens which will benefit my patients, and I will do no harm or injustice to them." He argued that the origins of diseases were natural and dismissed the belief that they were inflicted by gods in response to sin. He proposed the theory that an imbalance in the humors of blood, phlegm, yellow bile, and black bile resulted in inflammation, disease, and pain. He promoted a holistic approach to treatment, emphasizing the importance of rest, hygiene, diet, mental well-being, and herbal remedies. His famous saying, "If you want to learn about the health of a population, look at the air they breathe, the water they drink, and the places where they live," is just as pertinent today. Hippocrates and his followers used opium, the juice of the poppy plant, to treat pain and to control diarrhea and cough. I also wish to say Epharisto, meaning thank you, to Hippocrates for his invaluable role in shaping the definition of the mission and ethics of medicine. There was a prolonged era during which scientific medicine remained stagnant. Even as organized religions took a foothold in various nations in the late BCs through early ADs, the notion that pain, suffering, and illness were divine retribution for sins remained deeply rooted. Treatments continued to be centered on faith, prayers, and exorcism.
Question number 63. Who carried on the mantle of medicine after Hippocrates?
Answer. Claudius Galen, 129 to 216 AD, was a Greek-Roman physician and one of the leading physicians in ancient Rome. He promoted the humoral theory of Hippocrates. However, most of his work was devoted to the dissection of primate and mammals and study of the anatomy, which he regarded as the foundation of medical knowledge. He identified pain as an indicator of disease, and that three conditions were necessary for its perception: a receptor of the stimulus, a connecting nerve pathway, and a central processing center in the brain where it is perceived.
Question number 64. What other significant breakthroughs followed Galen's contributions to the understanding of the anatomy of pain?
Answer: French philosopher and scientist René Descartes, 1596 to 1650, proposed the theory of dualism, asserting that the body and mind exist separately. He described pain as a physical sensation that occurs in the body but is perceived in the mind, paving the way for the understanding that pain has both physical and psychological dimensions. He introduced the theory of a pain pathway, suggesting that a pain signal travels from the injury site through a nerve directly to a brain center where it is perceived. Between 1880 and 1940, many scientists worked tirelessly to understand the anatomy of neurons and synapses and the physiology of chemical neurotransmitters. The discovery of ether as an anesthetic gas deserves mention. The first public display occurred on October 16, 1846, at the Massachusetts General Hospital, Boston, in an amphitheater that is now known as the Ether Dome. A dentist, Dr. William Morton, anesthetized a patient with ether, and a surgeon, Dr. John Warren, successfully removed a tumor from the patient's neck. This breakthrough changed surgery from a distressing and painful ordeal to a more humane experience. The use of ether as a general anesthetic spread widely around the world. Ether was replaced by newer and safer inhalation agents in the 1960s. Attending a meeting at the Ether Dome was always special for me, given its historical significance. I was a senior resident in neurosurgery when I gave my first presentation at the Ether Dome, and the subject was the history of pain management. In attendance was Dr. William Sweet, one of my professors, and a pioneer of neurosurgical pain management and education. Dr. James White and Dr. William Sweet co-authored a book, Pain and the Neurosurgeon, a 40-year experience, which was published in 1969. Dr. John Bonica, an anesthesiologist at the University of Washington in Seattle, was a pioneer of interdisciplinary pain management, and he championed the creation of specialized pain clinics. In 1947, he established the first multidisciplinary pain clinic at his hospital with services from anesthesiologists, neurologists, psychologists, and other healthcare professionals. He also introduced innovative interventional techniques. In 1953, he published the groundbreaking book, The Management of Pain.
Question number 65. You pointed out that after René Descartes, scientists focused on the study of neurons and neurotransmitters. Did their work help in shaping current pain medicine?
Answer: yes, it certainly did. After 400 years, a significant milestone in the understanding of pain emerged in 1965, when Canadian psychologist Ronald Melzack and British anatomist Patrick Wall presented the gate control theory of pain. They challenged the view of René Descartes that a pain signal travels from the injury site through a nerve directly to a brain center where it is perceived. The gate control theory of pain proposes that a mechanism in the spinal cord acts like a gate which inhibits or facilitates the transmission of a stimulus from a site of injury to the brain, where it is processed and can be influenced by psychological factors before the sensation is perceived as pain. Descending messages from higher centers of the brain to the spinal cord can also close the gate. Researchers used this theory and its adaptations as a foundation for developing various treatments. The psychological factors that can modulate pain perception include anxiety, stress, and depression. Psychological counseling and cognitive behavioral therapy were introduced. Medications were produced either to block the message from reaching or passing through the gate, or to activate the inhibition from the higher centers in the cortex of the brain. Nerve ablation and various types of electrical stimulation of the nerve, spinal cord, and brain were developed to activate the inhibitory pathways or suppress those that facilitate the transmission of pain.